Hello everybody, and welcome to the Tuesday edition of Video Clips. And as usual, I will start with some announcements. First of all, the last ofs for 2014. Can't believe we're already at this place, but the last Food Over Medicine class starting right now. The last business training class starting in another week. And of course, conferences coming November 14 through 16. Some of the best speakers in the country about diet and cancer and treating mental and emotional disorders and ADHD without drugs. And I could go on, but you can actually go online to wellnessforum.com and read about it. And by the way, check out our jazzy new calendar online that has everything in one place. So now, no matter what you're interested in doing with the Wellness Forum, the entries are all there. You just click on one thing, and then every month it has everything listed. I'm really excited about it because it keeps people from having to juggle a whole bunch of different pieces of paper and know what we're up to these days. So you can read about all the stuff I talked about online. Okay, so that's the announcements. Let's go on and talk about some things we need to discuss today, starting with unnecessary treatment. And I'm going to refer to a guy who I talked about just a few weeks ago, Dr. Joe Mandrola. He's a medical doctor, and he's been doing a lot of blogging and writing articles about all the issues in healthcare, and he's really talking about many of the same things that I'm talking about, only he's inside the system and he's an MD talking about them. So I love this guy. Every time I read another one of his entries, he's like more one of us. I think, I know it will never happen, but I'm just going to say out loud, I think he would be a great United States Surgeon General. So let's put that thought out there and see if we can get it going. All right, his most recent article, the one that's the topic for this, that I'm using as the basis for this article, is Let's Stop the Unnecessary Treatment of Heart Disease. And he starts out by talking about the fact that doctors are so burned out and they suffer from compassion fatigue. In other words, the practice of medicine is not much fun for a lot of docs these days. And he says it's in part due to the fact that, and this is his quote, not mine, he says, much of what we do is so damned unnecessary. He says that most health professionals spend all their time treating people for diseases that they just don't have to get. And of course, to that, I would add that they don't get much better as a result of the treatment. That makes it really not much fun at all. He's very critical of the way that doctors interact with patients, ignoring important things like obesity, eating habits, but focusing on surrogate markers like cholesterol. And he said, you know, doctors are just real quick to prescribe pills recommended by the guidelines without going through the honest discussion that sometimes can lead to meaningful change. He uses as an example a guy that weighs 300 pounds, has atrial fibrillation, he won't wear his sleep apnea mask, and is maybe thinking about having a procedure done to deal with his sleep apnea. And Mandrola says he won't do procedures, and he's happy to say no to this guy, even though it would be a $100,000 procedure. He says he is perfectly willing to get the reputation as the doctor who says, no, I won't do it, instead of being so enthusiastic about prescribing and doing procedures. He cites a study when he's talking about heart disease and why we just need to get rid of it, that 4 out of 5 heart attacks are preventable with diet and lifestyle change. And you might remember I just covered this a week or so ago where I talked about each additional lifestyle habit that you add decreases your risk even more. It's dose dependent. And he basically says, let's just put it on the table. Heart disease can be prevented, and that doctors need to start talking about it. And we have to stop, he actually says this, we have to stop suppressing the idea that heart disease can't be prevented and stop this silliness about people just won't do it. And he says, about this, he says, we have to develop strategies that motivate patients to make change. And I've been saying this for a long time. If I'm talking to somebody about changing their habits and I can't get them to do it, I need to start looking at myself as the communicator, not always blaming it on other people who won't do the things that are needed. And I think as a healthcare profession, we got to wake up and really accept responsibility for that. Well, armed with a belief that people can and will change, Mandrola does a lot of good things. He posts studies about the connection between lifestyle and heart disease in his office, and he engages in discussions. And he actually said in this blog article that he talks to his patients about the science and says that there's no reason for patients to get sick. It's very, very much the similar way that we do, or similar to the way that we address things here, where we think it's all about educating people so they can make good choices instead of just preaching to them about what you want them to do. And he says that patients are interested if you communicate the information well. He expects the discussions to go well, and they actually do. And he encourages things like eating well, exercising, not smoking, and then goes through all the benefits, better endothelial function, et cetera, et cetera. He says, reasons and expectations equal success. And this is a quote: the low-hanging fruit is right there. I say we reach up and grab it. And my gosh, I agree. And like I said, did I tell you I love this guy? I love reading his stuff, and I wish we had more doctors talking about this like he does. Well, while we're on the topic of unnecessary treatment, I want to talk about testosterone and DHEA for women. Now, I wrote a very long newsletter article earlier this year on testosterone replacement for men and what a bad idea it is most of the time. This comes from, all of this misbehavior with drugs, comes from taking something that might be a good idea for a tiny little percentage of the population and then making it available to everybody, in fact, encouraging everybody to do it. So lots of women are wearing testosterone patches, getting DHEA supplements. DHEA, by the way, is a precursor to testosterone, which is why it's prescribed. So here's the news. According to new practice guidelines issued by a task force that was appointed by, listen to these groups, the Endocrine Society, the American Congress of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, the European Society for Endocrinology, and the International Menopause Society, there is no evidence to support the use of testosterone and DHEA for women who have low levels of hormones. All right, so this is a whole big bunch of groups who appointed a task force. And by the way, a lot of these groups' members make their living prescribing testosterone to women. All right, so I don't have a whole lot of confidence that the guidelines will be followed, but I'm telling you what the guidelines are. Testosterone is widely prescribed to women, and the reasons, common reasons, are cognitive dysfunction, infertility, and sexual dysfunction. While acknowledging that some postmenopausal women suffering from low sexual desire might benefit, it's important, this task force says, to monitor patients closely for side effects such as acne and conditions like cardiovascular disease. And of course, the connection to cardiovascular disease is one of the things I talked about with men as well. Lead researcher Dr. Margaret Weirman stated in an article or an interview with Medscape that there are no FDA-approved testosterone drugs for women. Anytime a woman gets a testosterone drug or patch, it's off-label in the United States. Approval for the patch was withdrawn in Europe some time ago. The patch, called Intrinsa, was shown to result in one additional satisfying sexual episode per month and was designed for women with low sex drive and women who had undergone oophorectomy, or removal of the ovaries. It was never approved in the United States due to concerns about side effects, and including, by the way, the increased risk of breast cancer and developing cardiovascular disease. The manufacturer requested withdrawal of the marketing certificate in Europe in 2012. Now, do you know how bad a drug has to be when the manufacturer says, we'll take it off the market? Okay, so you get an idea what I'm talking about. Okay, so in addition to all this, the review showed that there was little relationship between testosterone levels and symptoms, and this was true for both newer and older tests, so improved testing hasn't really changed that very much. The task force concluded that there was no clear way to diagnose androgen deficiency in women, and at this time, testosterone therapy for healthy women cannot be justified, no benefit for DHEA either. And again, as I mentioned earlier, DHEA is a precursor, which is why it's prescribed. So the research is quite clear. This does not benefit men, doesn't benefit women, and the risks are far greater than any benefit that one might receive. So another bottom line, HRT, not good, except in very specific circumstances. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you again on Thursday with more news.